Bladder and bowel issues are unfortunately common with MS, and we'd like to show you some dynamic pelvic floor exercises which, if practiced regularly, should reduce your need to go to the loo. If we think about the pelvic floor, it's actually a muscular lining for the pelvis, and it attaches to the sitting bones, attaches to the tailbone and the pubic bone, these major muscles. So we're just going to think about sliding the tailbone forwards, and then as we breathe out, slide the tailbone and the pubic bone backwards. Yeah, it's as if we're on wheels on the chair here. Yeah, tailbone forwards and then tailbone backwards. So if you think the function of muscle is to move bone as well as to provide support, if we think about moving these bones, then we're having a nice dynamic, effective way to train that muscular lining. So let's try now, Arvina, taking the weight onto one side. That's it, and just slightly lifting that one sitting bone, and then bring the weight back through the center, breathing in, and then exhaling, float the other sitting bone. Acknowledging that movement within the pelvis, and on the exhale, encouraging and noticing that natural lift happening in the lining of the pelvis. Let's make this the last pair. Having your head centered, especially in that position that you sit on the rollator, really good for getting the head directly over the center of the pelvic lining. So the weight of the head being supported by those muscles, so they're getting to work. So when you're back at the center, we'll do a little bottom walking. So there's not so much space on the rollator, but on a bigger chair, we can walk forwards with the bottom, scoopy forward bottom. Sorry, one side going forwards, then the other. That's it. And then finally, you can use a cushion or a ball. This is a Franklin method mini roller. It's well shaped, but we can use pillows, cushions. If we just put this between the knees, that's it. Okay, so take a breath in, and then as you breathe out, squeezing on the roller, allow the pelvic lining to lift up into the tummy, and then breathing in when you need to, relaxing for the pelvic floor, just as important as contracting. So again, as we exhale, feel the pelvic lining lift into the tummy, maintaining that lift, and then exhaling once again. So dynamic training of those important muscles that not only provide containment and support, but move our bodies as well. Let's make this the last one. Moving on the exhale and resting just there. Okay. Let's have a little stretch to finish. So if you take the legs wide, that's it. And then hinging forward, just gently pressing out into the knees. How's that feeling? Great. Feel a nice stretch there. Yeah. Okay, and then coming back together. But of course you can take longer over this than we've done, and little and often very convenient in a chair, so one might not even notice that you were training. We'll see you next time.